And also tonight, state leaders are now scrambling to provide some data to help protect the CDC. They want to put some real numbers to the disproportionate number of African Americans who are unfortunately dying from COVID-19. Our 13 Investigates reporter Sandra Chapman shows us why some Indiana lawmakers and groups like the NAACP, they are urging Governor Holcomb to please change the way that Indiana tracks this outbreak.
It took numbers from just a few states to see the dangerous trend emerging. Black Americans are dying at higher rates from complications of the coronavirus than whites. In Milwaukee, blacks are just 26% of the county population, but represent 70% of COVID-19 deaths.
It's not that they're getting infected more often, it's that when they do get infected, their underlying medical conditions, the diabetes, the hypertension, the obesity, the asthma, those are the kind of things that wind them up in the ICU and ultimately give them a higher death rate.
According to an analysis by the Center for American Progress in Washington, D.C., the numbers are also a glaring view of inequities in health care.
They face some serious structural barriers to getting the health care they needed. Everything from discrimination and cost to lack of health care coverage.
Connor Maxwell is a senior policy analyst at American Progress. His team and the NAACP are calling states to better track COVID-19 data.
So there are dozens of states that haven't released any data on race.
Indiana is one of those states. In a letter obtained by 13 Investigates, Indiana's Black Legislative Caucus is calling on Governor Holcomb to change the state's tracking system. They want state health officials to provide data for Black, white, Latino, and Asian Hoosiers, including the number of people tested for coronavirus, the number of positive results, those hospitalized, and the number of deaths. The letter, signed by more than a dozen minority lawmakers, says we fear that during this time, the aforementioned disparities would cost us more lives. Please work quickly to make this information available. American Progress says health officials should have learned from the H1N1 crisis when Hispanic and Native American communities were hard hit. The center warns more communities of color could be at risk based on a new Harvard study on environmental factors.
Individuals who live in areas with high levels of air pollution are 15% more likely to die if they contract coronavirus. Places like Lake County with some of the biggest pollution burdens in the region.
The State Department of Health is expected to release Indiana's numbers yet this week. American Progress says the next step is for states to expand access to free and low-cost testing and treatment for coronavirus.